Welcome everyone with new disease in the internal medicine disease. The disease of the today will be talk about a new disease called sarcoidosis. Sarcoidosis is a multi-systemic disease, multi-systemic granulomatous disorder. It is of unknown etiology, characterized by presence of non-caseating granuloma. Geographic distribution. It is more common in the cold part of northern Europe. Uh, it is rare in the Eskimo, Arab, and Chinese. More common with climate, tendency for sarco to be present in spring and summer. This leads to the speculation about the role of the infective agent, including mycobacteria, probiobacteria, and virus, but the cause remains elusive. Presentation of sarcoidosis. Sarcoidosis present with many symptoms, maybe asymptomatic, and find an abnormal routine chest X-ray in 13% of the patient, or present with abnormal liver function test, or present of respiratory and constitutional symptom in 20 to 30%, present with erythematous nodosum and arthralgia in 20 to 30%, present with ocular symptom in 5 to 10%, present with skin sarcoid including lupus perennial, skin lupus perennial in 5%, present with superficial lymphadenopathy in 5%, other 1% present with hypercalcemia, diabetes insipidus, cranial nerve palsy, cardiac arrhythmia, nephrocalcinosis. We will now talk about the possible systemic involvement in sarcoidosis. Sarcoidosis present with lacrimal gland enlargement, present with Zika syndrome, anterior uveitis, parotid gland enlargement, bilateral hilar lymphadenopathy, cardiac arrhythmia, heart block, sudden death, splenomegaly, nephrocalcinosis, calciuria, renal stone, erythema nodosum, arthropathy, osteoporosis, nasal cutaneous sarcoid, lesion lupus perennial, cranial nerve palsy, interstitial lung disease, granulomatous liver disease, pharyngeal bone cyst, skin plaques and nodule, infiltration of scar, arthropathy, osteoporosis, mononeuritis multiplex, meningitis, space occluding lesion, lymphadenopathy, diabetes insipidus, peripheral neuropathy. We can classify as follow with present with uveitis or lacrimal gland enlargement, Zika syndrome, present with skin perennial, present with ocular occupation lesion, or present of peripheral neuropathy, present with erythema nodosum, cardiac arrhythmia, sudden death, heart block, splenomegaly, nephrocalcinosis, renal stone, hypercalciuria, and arthropathy, or as this, according to the part of organ affected. Now we will talk about the investigation we can use for diagnosis of the disease. In the disease there is lymphopenia. Number 2, liver function test mildly deranged. Number 3, hypercalcemia. Number 4, hypercalciuria. Serum. Number 5, serum ACE, non-specific marker of disease activity and can assist in monitoring the clinical course. Number 6, chest radiography to stag sarcoids. Number 7, pulmonary function test in patient with pulmonary infiltrate may accompany by impaired gas exchange. Number 8, exercise test may reveal oxygen desaturation. Number 9, bronchoscopy may demonstrate cobblestone appearance of the mucosa. Also number 10, bronchial and transbronchial biopsy show non-caseating granulomatous. Also can be present here T cell. Now we will talk about 11, histological examination of the involved organ. Number 12, presence of allergy, example to tuberculin skin test may support the diagnosis. But to talk about the management of the disease. There is many drugs are used for this treatment of disease. Example, naside, topical steroid, inhaler corticosteroid, chloroquine, hydroxychloroquine, low dose of thalidomide. Also can be use of the alpha 5-methotrexate, azathioprine. Also use specific human necrosis factor TNF this week, and now we will talk about each one of the drug and the use of it. We can use naside for patient with erythema nodosum. Short course of corticosteroid used if the disease is severe. Topical steroid uses in cause of uveitis. Methotrexate, systemic corticosteroid, can be used also. Because use 5-methotrexate 10 to 20 milligram per week, or azathioprine 50 to 150 milligram per day. Also specific tumor necrosis factor inhibitor have been effective. Topical, we talk about it. Also chloroquine and hydroxychloroquine and low dose thalidomide in cutaneous sarcoid with unlimited pulmonary involvement. In cutaneous, can use chloroquine and hydroxychloroquine and thalidomide. Selected patient may be referred for consideration of single lung transplantation, and overall mortality is low, 1 to 5%, and usually reflect cardiac involvement or pulmonary fibrosis. Also talk about systemic corticosteroid. Here corticosteroid in disease severe, we can use prednisolone 20 to 40 milligram per day for 6 months, and should be withdrawal gradually. Common immediate should be withdrawal, as we say, gradually. No, it is used, and if there is no evidence of organ damage, systemic the majority of patients enjoy spontaneous remission. So we talk about the corticosteroid here. This is the disease sarcoidosis. We talk about everything about the definition and geographic distribution, climate, clinical presentation, clinical symptom, and investigation used for diagnosis of the disease and the treatment of the disease. I hope you enjoy with it and take the benefit of it. For any comment or discussion about the disease, or any ask or question about the disease, you can ask me at osamatube.com, Osama Bahudila, Dr. Osama Ahmed Bahudila. Thank you very much and welcome.